Hello and welcome back. My name is Joseph Tsuma, always your favorite doctor. And when you see me here, you know it is Matters Health. I'm here to bring you trusted health information wherever you are. You can follow me for simple, updated medical insights that will be able to keep you and your family healthy. You can subscribe to my YouTube channel at Dr. on Wheels. You can also follow me at a personal level here on TikTok at Dr. Itsuma. Now, I want us to continue with our series that we had started before, okay, on why your doctor basically can or indicated or prescribed cesarean section as a way of delivering your baby. Okay, and the fifth reason why your doctor might prescribe or might indicate for a cesarean section is when you have had previous maternal surgeries, okay, to the uterus. But before we dive into today's topic, I want us to listen to some words of wisdom from the book of Jeremiah, chapter 29, verse 11. And the Bible says, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you a hope in the future." So let us dive direct into today's topic. But before we get deeper, I want us to basically just remind ourselves what exactly is a cesarean section. So a cesarean section is a surgical procedure or an operation, okay, that is done to a pregnant woman, okay, to basically help to deliver that baby, especially if the mother is not able to deliver via vaginal delivery. Now, if a woman has had a previous history of a surgery into the womb, okay, or into the uterus, okay, for whatever reasons, okay, so you have a scar in the uterus, okay, your doctor might actually recommend you to end up having a cesarean section as a way of delivering your baby. Okay, so what are some of these maternal surgeries or procedures that might actually end up putting a scar in your uterus? So number one is if you have had a previous cesarean section. So in your previous pregnancy, you ended up having, you delivered through a cesarean section. So that one is a scar on your tissue, on your uterus. Number two is if you have had myomectomy. So myomectomy is a procedure whereby the doctor goes ahead and cuts through the uterus to basically remove fibroids or uterine fibroids. Okay, so basically that puts a scar in the uterus and it makes the uterus a bit weaker. Okay, and then number three is if you probably had a previous uterine rupture, okay, and the doctor ended up repairing the tear, okay, to the uterus, okay, so that one can actually as well be an indication, okay, or if you have had a previous uterine surgery, okay, for whatever reason, like let's say for example, someone who has been born with congenital uterine abnormalities, okay, or in the process, someone basically ended up with either infections that ended up causing the uterus to basically have some issues, and therefore the doctor went ahead to try and repair those abnormalities, and the doctor had to cut through the uterus to be able to access inside and basically repair. So those are basically some of the maternal procedures that can put a scar in your uterus, and that scar in itself is a weak point. Okay, so during pregnancy, the uterus basically expands to allow and accommodate for the growing baby. Okay, now during the time when you start the labor, okay, because of the contraction, okay, the scar, where there is a scar, the scar is not as strong as the rest of the tissue, so it can act as a weak point, and therefore because of strong contraction you might end up with rupture. Okay, and it goes without saying, if you end up with rupture or a uterine tear, okay, you'll end up with a lot of bleeding, and the worst case scenario is that you might end up losing even your life or even the life of the baby, but also even your life as well. Okay, now If you have had any of these procedures, okay, your doctor might recommend for what we call an elective or a planned cesarean section. And it's important because with a planned cesarean section, it means, therefore, the procedure is done before labor starts. Okay, and that basically prevents the uterus from contracting, and it also helps to now prevent some of those complications we are going to discuss. So the planned procedure normally is done from 38 completed weeks to around 39 completed weeks, depending on the doctor, okay, but thereabout, okay. But then if it happens that labor begins um, uh, before the 38 completed weeks, the doctor might actually recommend you to have an emergency cesarean section, okay, which basically helps as well to prevent some of these complications. Now, what are some of the benefits of having a planned cesarean section, or what we call elective cesarean section? So it basically helps to deliver the baby before the uterus starts to contract. And in that process, you are actually preventing a risk of uterine rupture. Okay. Now, uterine rupture basically comes with its own complication, including heavy bleeding. And with heavy bleeding, it means you can either, the baby can go into distress, the mother can go into hypovolemic shock, okay, and all that. And that basically helps to keep both the mother and the baby safe. Now, if you have had a uterine procedure before and you are pregnant, what are some of the danger signs that you need to be aware about, that you need to go to the hospital as soon as possible when you feel any of those? Okay, so number one, if you start experiencing severe abdominal pain, don't wait, you need to go to the hospital as soon as possible. Anytime you start having bleeding, any kind of bleeding during pregnancy is a danger sign. You need to be aware about that, and you need to rush to the hospital as soon as possible. Okay, and for the mothers who have had a cesarean section or any kind of uterine surgery, anytime you start seeing discharge from either the wound or even discharge vaginally, that one is a danger sign. You need to go to the hospital. And the other thing is when you have reduced fetal movements, when the baby has stopped, is not playing as they used to. Okay, so those are in a nutshell some of the danger signs that you need to be aware about. But I have done a complete video on maternal danger signs, okay, that you can actually go through and basically look at them in details. Okay, now lastly, I want to encourage someone here that having had a previous uterine surgery is not a death sentence for you not to be able to give birth to a healthy baby. Okay, so with proper monitoring, okay, and a planned cesarean section, both you and your baby can be taken care of, and you can give birth to a very healthy baby with no any complications, and live very healthy. Okay, now if you have found this content very helpful, you can consider following me here on TikTok. Okay, following us here on TikTok, but you can also follow me at a personal level at Dr. Itsuma, and you can also follow me on social media at Joseph Tsuma, both on Facebook and on Instagram. Now, if you have any question or any consultation, you can always visit us at our hospital. We are located at Lubsil Center, okay, which is on the ground floor opposite Juango Petrol Station at VET in Ngong Town. For online consultations, you can always reach out to me via our numbers. They are on the bio, and we will be able to help you. Now, until next time, God bless.